Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh AGTE. We were discussing Dipan and Pachan Karma, and during this discussion, we have traveled a long distance incorporating various other principles also, that too in a very clinical way. In that regards, I have put a case in front of you that a person is having hunger, but its quantity of food is now on lesser side. He was eating 3 rotis and good amount of rice, but now he is eating 2 rotis and small amount of rice. How to evaluate this patient? The first answer we discussed that it is a case of Pittakshay, Pitte Mandonala Shitam. So you have to use Pitta Vruddhikara Guna, which are Agni Saman, Ushna Tishna Lagu Ruksha, which will increase the Agni and the complaint will be corrected. But if there is no any reason at the physical level, you must keep in mind the Manasa Hetu. Chinta, Shok, stress always contribute for this symptom, and nowadays because of today's lifestyle, this complaint you will find frequently in your clinic. Now the question is, how will you evaluate if the Hetu is Manas and what will be the line of treatment? Obviously the Manas Hetu is there, so treatment on Mana or Manas is recommended. You can give Medhya, you can give Sattvaja Chikitsa, you must go for the counseling. But another factor which is also very important, which is always missed, and this factor is Pranavayu. What are the karma of Pranavayu? Hridayendriya Chitta Dhruv. So it is the Pranavayu is the commander of mind. It is very close to the mind, and with the use of Pranavayu we can reach the mind very easily. And hence, when you are treating such patients, along with the Manas Chikitsa, you have to think of the Pranavayu, which will give you a great and fast result. Now, what is the patient complaining? That his appetite is on lesser side, and he particularly tells you that I have hunger लेकिन खाने का मन नहीं लगता. I have hunger but I am not willing to eat. Now the functions of Pranavayu are Nishwas Anna Praveshakrut. Anna Praveshakrut is the one of the function of Pranavayu. Now how it comes in action in this case? You will say Anna Praveshakrut is okay, it is getting inside the stomach easily, there is no problem in the Anna Pravesh Karma as such. The problem is the patient is not willing, with no desire to eat, no interest of in taking the food is the main problem. Yes, Chinta, Shok are the reasons, but if you give strain to the Pranavayu, it will help to control the mind also. Now what is the karma of or function of Pranavayu? It is the bridge between the outside environment and our inner body. So Anna Praveshakrut, Nishwasa, taking air, is a communicator between both of us. And what is the third function, which is also important, which is the connection between the outside world and our body, is like Anna Pravesh, like Nishwas, it also takes Indriyartha inside the body. So when there are Manas Hetu and you will find appetite is lesser side, at the same time inquire about the other senses also, you will find that person is not interested in listening the good music, in listening the movies or any other thing. So it hampers all indriyartha, not only the appetite. And that's why the pranavayu role comes in that way. If you give strength to the pranavayu, it will we can reach the mind very fast and in a good way. So in such cases you have to give medicines for pranavayu, or if you are using Nidya which are obvious to use, you can give them at pranavayu kal, it means muhur. Simultaneously you will be it will be helpful to give proper pranayam to the patient, which will have a good control on pranavayu and also on the mind. So when there is manas hetu, in such cases you have to think on the three levels. First, manas chikitsa, it may be made there, it may be a counseling, it may be a sattva, it may be some spiritual if required. Second, symptomatic, which will agni saman guna dharma, which will keep the agni in good optimum level. And third one, think of pranavayu by muhur aushad, by pranayam, and even with the nasya chikitsa. So the factors which are acting on pranavayu will also a factor in such case, and this factor is often neglected. I will request you that when such patient come to you, think of pranavayu, give medicine to the specific what we have discussed now on pranavayu, you will find a very better and very fast result, because it is the indriya chitta dhruv pranavayu. So it will control all the senses including mind. So in the clinical evaluation of such patient with manas hetu, think of manas chikitsa, think of pranavayu, and think of agni pradhan chikitsa as a symptomatic one. We will discuss some other topic, new topic in the next episode. Please subscribe and also forward to your all friends the link of our YouTube channel Clinical Ayurved by Dr. Mayuresh AGTE. Thank you very much.